What's good, everybody? Get you set up in our usual location. Oh, back with another one. Been meaning to change my channel name from PS4 Gaming. I haven't turned my PS4 on in like 4 weeks, probably longer. But forgot what I was gonna do a video about. But as you can see, my beard is kind of coming in real thick. It's always been blonde right here. So was kind of thinking about oh different things about nursing. I just hate nursing. I really do. I, and it's just a mixture of everything. You know, you go to school for all this time, you learn all this different stuff, and then you walk into a room where people try to pretend like they know more than you. They try to pretend like they know more than the doctors, and then you just agree to disagree and you walk away. And then you go outside and you get yelled at by somebody that says that you didn't do this correctly, you didn't do that correctly, or you didn't document this. Then your manager comes by and they have to say something too. And then, God forbid that you get to work on one shift the entire time. You have to work a week of days, and then the next week you're doing a week of nights. And because you work days and nights, you can't get a second job because they only want you certain days of the week, and they only want you on certain shifts. But if you work days and nights at this other job, you can't fulfill it. So, well, I think it's always. So here's a situation. I I want to try to last about a year, and then I want to do absolutely anything else besides nursing. Oh, it ticks me off so bad. From every last little aspect of it, just makes me so mad. And I have so many different people that tell me about it, and they're like, "No, don't be like that. Don't just go home and relax and do that." And I'm like, "Oh, I can't. I can't go home and relax because I work Monday, I work Wednesday, and then I have to work Friday, but then I have to be back up here Sunday morning because you flip me from days to nights." Or this last job I had, I was strictly day shift, and I told them that when I got hired that I wanted to be strictly days because I have family. I don't want to be sleeping all day on my days off. And if anybody that works night shift, you know this. If you only work 3 days, you work 3 days in a row night shift. That day that you get off, you're basically going to sleep during the day because you just worked all night, and then you're going to try to sleep that night as well. That way that you're fixed for that next day. So let's say Sunday, Monday, Tuesday you work that night. Wednesday is gone. There's no chance in you working, or there's no chance in you, doing anything with your family. Thursday, Friday are regular days, and then Saturday, if you go to sleep at night, which most people will, you go to sleep at night. That means you're going to stay up on Sunday, so you'll be up all day Sunday plus work Sunday night. So it's ridiculous. So that was the reason why I didn't work night shift. I wanted to work day shift because you don't lose any days, you don't lose any sleep doing that. If you work Monday, Tuesday, Wednesday, or Sunday, Monday, Tuesday, you get up on Wednesday and you start your day. There's no, there's nothing to do. No bad stuff happens when your family's asleep. You go to sleep. Everything is good. Now this other place, you do day-night rotation. So they swapped me to day-night rotation for 1 week. And I told them just what I thought about that, and I quickly got off of that. because I told him when I got hired, I said, I will not, under any circumstances, in the same 7 day period, work days and nights. Because that's what they like to do to you. They like to have you work Monday night, Wednesday morning, Thursday night. That's the type of stuff they like you to do. So instead of you losing 3 days, you lose four because the day before you transition, you've got to try to go to sleep. And then if you don't and you just stay up, you work that night, then you go back and you go to sleep. When you get off, you've still got to transition back to day shift living. Now, a way around that is this transition for night shift life. But if you have a family, they function on a day shift. So you can't do anything about it. You've got to jump back and forth. And it sucks. Either you sleep way too much or you don't get enough sleep. There's there's no in between. There's no other way to do it. So, and I've had people that they get off on that day and then they stay up all day and then they go to sleep at night with their family and that restarts everything. That sucks too. If you've been awake for 12 hours, you've been working your butt off, you're tired, it's hard to stay awake another 12 hours, maybe even longer before somebody wants to go to sleep. That's ridiculous hard. So it's crappy. And the places that do that to you, that make you flip back and forth, to me are just evil. Why do you have them do that? Why can't you just hire people for days and nights? It doesn't make any sense. Like, there's going to be people that want to do day shift, there's going to be people that want to do night shift, and a lot of places, if you have night shift available, they want day shift, they'll still apply. And you tell them, hey, all we have is nights right now. Day shift comes around, we'll swing you in. They'll still work for you. If you make just days and nights available like that, you're still going to have as many nurses as you need. If you do this day-night rotation stuff, it's just crap. Then you got to keep up with everybody. You got to just pencil in people here and there. And it's stupid. It's the dumbest thing ever. And you're cutting off my money supply. If I want to go and make extra money, if I want to work Monday, Tuesday, Wednesday, say I want to work just nights, then I can go pick up a night shift Thursday night. I can go pick up a night shift Friday night. Saturday, I can work 7 nights in a row. Problem is when you start swapping me days and nights, there's times that I can't physically work because either I've already worked 12 hours and I can't go work another 12 somewhere else because I'll just be too tired, or I can't pick up any time because you can only work 16 hours at one place. It's ridiculous. So, at the same time, if I sign up for 3 days a week with you and you're costing me 5 days by all the sleeping and staying awake that I have to do type stuff, that's crap too. Because you're not paying me for 5 days, you're paying me for three. And I believe all 3 days should be on the same. Now, they did that to me once, and I told them, and from the very start, I wasn't doing it. And that week came, and I said, I don't know who put this in, but I told you guys when I first got hired, I'm not doing this, and I do not intend to. Called my agency, and they said, well, we're not in charge of scheduling. And I said, I told you this when I first got hired. They said, well, it's not in your contract. And I said, I don't care if it's in the contract or not. I am not doing it. This is ridiculous, and I refuse. So they ended up changing it. They put me all on nights, and I told them, I don't mind going from days to nights, but it needs to be a separate week. I would like my days grouped together if possible, if I'm living in a town away from my family. This place that I'm working now has given me all nights. There's not a whole lot of time to pick up, which I'm okay with that. But the last place, geez, and that was a big thing for me. Other stuff is getting to me. You've got all these patients that just, so much of what they call cancel culture now. When you tell someone no, they get so offended. They think everything should be yes. You get these patients that, I'm not saying when you call me, you need to be overly appreciative of me. You need to worship the ground I walk on. I don't require all that. But what I do require is for you not to treat me like a servant, because I'm not a servant. Do not call me to tell me to move your cup. You need stuff cleared off your table. All this can go in the trash. Well, you can get your ass up and do it. You're not handicapped. And that's what I end up telling people. I let them know, I say, you are not handicapped. You can get up and clean off your own table. And when I get the response, that's not my job, I let them know, yes, it is. Your job is to take care of yourself. If you can't take care of yourself, then you need to go on a nursing home. We are not a nursing home. We are a hospital. We are here to make you better. We are not here to do things for you. We are not here to wipe your butt for you. If you can do it yourself, you do it yourself. I have had 20 something year old people. There was a 26-year-old girl that would pee her pants and have us try to change her because she said she was in the hospital, and that's what we're supposed to do. If I could choke somebody, I would. This is so ridiculous. It doesn't make any sense. I am there to take care of sick people. I am there to help people who can't help themselves. I'm not here for foolishness. We have people that come in just for a bed and a meal, and then they leave. They leave AMA. And you do all this paperwork. You have to do so much paperwork. People don't understand how much paperwork you have to do to get a patient on the floor. You have to do a full admission assessment. We have to ask all these questions. We have to put all these medicines in. We have to conference with the doctor, and we have to get a treatment plan going, a care plan. We have to document on all of that. We have to give you any kind of medicines, do IV fluids. Oh, your IV went bad. We got to put another one in. We got to do telemetry strips. We got to do all kind of stuff on this one patient that we have out of 6 or 8 or however many that you have. In Virginia, I saw they take 12. You have all these patients you have to do this stuff with. You've got that one person that it's going to take you forever to do all this stuff because there's all these lights going off. Hey, I need some water. You can't have water. You have surgery in the morning. Oh, I just need some water. No, you can't have any water. Well, what am I supposed to do? You're not going to have water. That's what you're supposed to do. If you drink water, you're not gonna have this heart surgery. Doctor's gonna be pissed. I'm not getting pissed. I'm not getting yelled at because you wanted some water when he's got orders that you're not gonna have water. Then the next person, they fail, so I have to go help them. They fell because they wanted to go to the chair at 2 o'clock in the morning, and they know better that they should call because it's pitch black. They're hooked to all kind of machines. They're in their right state of mind, but we still tell them to call, and they don't. So now that they fall, we have more paperwork. We got to assess them. Got to make sure nothing's hurt. Got to make sure everything is good. We get that done. We do our every 4 hour charting. If you're in ICU, you're doing every 2 hours. Other places you might do once a shift, once a day, whatever. Then you look up, hey, here's your guy that you just admitted, you just did all that paperwork on. He's leaving. You say, hey, don't leave. Yeah, fuck you, I'm leaving. He dips out. Now you got AMA paperwork. You got to call people. You got to say, hey, I got this guy's leaving. Just let him go. Everything. I mean, we can't stop him. He's in his right mind. He can go. He just wanted some meal. I've literally had people come in just to get some food. They would not just give them food in the ER. They would admit them to the hospital. They would come in, get a plate of food, eat the food, and then leave. That's what they would do. Racked up all kind of hospital debt they're not going to pay, and then just dip out. So now you got all that paperwork to do. Oh, guess what? Now that your patient left, you're opening for an admission. We don't have housekeeping coming. So you need to go strip the beds and you need to go do all this and do that. And then what I don't understand is, why is it I have to set up a room? Every room in a hospital should be set up the same way, in my opinion. Every room. You'd have oxygen on the wall. If you could have suction, have it set up. Put a pad down on the bed. If you guys want a draw sheet on there, put a draw sheet, but put at least a pad, a pillow, blanket, flat sheet. You're done. Everything else is good. Any other little bits and pieces, bring it in yourself. But no, you don't. You got to bring everything in here. Everything you're going to need. You got to fix the room up. You got to strip it down. You got to bring extra stuff in the room after they've fixed it for you. It doesn't make any sense. You're trying to do everything under the sun, but you can't clock out past 7:30. They want you out. They don't want to pay you anymore because they understand that if if you stay 30 minutes extra, that it costs them money. If you make 25 bucks an hour, 30 minutes is 12.50. If it's overtime, it's about $19, something like that. Is what it costs them. A lot of people don't clock out for lunch. They can't. It still gets taken away. You write it in your book, whatever, still get taken away. It still doesn't get taken away. The place I'm at now is okay. It has some stuff that I don't like about it. They hold the patients in the ER, and then all of a sudden they discharge everybody in the ER at one time. So you'll get 4 admissions at one time, which if everyone's doing their own admission, it's not a big deal. But the problem is everyone's doing an admission. No one can answer call lights because we never have CNAs. Nowhere that you work, you will ever have CNAs. That's just the truth of the matter. CNAs do not exist. They go to nursing homes to work. They are part time at hospitals, and they only work when they feel like it. They're always sick. Their babies are always sick. They'll never be there. You'll only have the nurses. And anytime you need 5 nurses, you'll only have 4. You may have 3. You will never have the appropriate amount of nurses, or you will have an abundance of nurses. The place I'm at now makes no sense with staffing because we could literally be 2 nurses short on the night shift and have to call 2 nurses off during the day, call 3 nurses off during the day. Why? Makes no sense. Why don't you call those people and tell them, hey, this is our census right now. We've got 6 or 7 people scheduled on the day shift. We know we're not going to need that many. Do any of you guys want to work night shift? If they say no, keep doing what you're doing. Everything is good. But I think the thing of it's going to be, when you call people off enough times, they're going to want to jump ship. They're going to want to, hey, I'm going to come and work day shift. I'm going to come and work night shift. That's how it's going to happen. At this place also, as I've said, you'll get 4 admissions. I don't mean with one person. But let's just say you've got 3 nurses. There's been a time that I've showed up to work, haven't even clocked in yet, and they're telling me, hey, report's on the phone. Yeah, well, I haven't clocked in. I can't clock in yet. You need to take report. I'm not taking shit. I'm not on the clock. I'm not doing anything. I'm not here until I clock in. I can look at my patients, I can do whatever I want, but I'm not working. So it gets to be 6:53, the earliest time you can clock in. Hey, report's on the phone. You get report. Then they call back. Hey, we've got 3 more patients. Then they come up to you and say, hey, here's a patient you're getting. Everybody's getting one. Yeah, I haven't got the first one yet. Oh, well, you're getting the second one. So now you've got 2 patients, both coming at the same time. And you say, hey, I just got a patient. Can you hold them? No, I can't hold them. Or they get an attitude about it. No, I just can't do it. We've got a line of people back here. We've got to send them up. I'm telling you, there's been a time where I have literally sat someone in the bed and said, I'll be back right after I get this other person sat in bed, and had to walk out and put another person in bed because they send them that quick, that fast behind you. Makes no sense. Nurse patient ratios are not safe. The place in Bismarck was great. You always had safe. I had 6 patients one night for 4 hours, and it was weird. That was the only time we'd ever had that. Normally you have 5 at night. On the daytime, the most you have is 4. I've worked other places that if you're the only one, they'll stick you with all 23 patients. They do not care. And I'll be the first one to tell you, your boy is not clocking in. I check the assignment before I clock in. That way there's nothing they can say. I'll walk in and I'll say, look, I'm not doing it. And they'll say, well, you got to. No, I don't. I'm not clocked in. I'm not on the clock. Later, I'll dip out. I sure will. I've almost walked out before in Mississippi. Just not doing it. And it's things like that. The money is fine. The money is great. I've got a nice truck. I've got a nice camper. We got a nice place to stay. We get nice things. We buy what we want. We don't have to struggle for anything. We're not living paycheck to paycheck. Everything is good. The money is not an issue. I don't really care about the money anymore. I don't care about the profession. You don't have anyone that sticks up for nurses. You're just a number, is all you are. If you ever think that you're anything but a number, you're wrong. And anybody that's watching this that is thinking about becoming a nurse, you might be better at it than me. You really might. I'm not trying to deter you from being a nurse, but there's things you need to know, and there's things that you need to be aware of because it sounds amazing at first. And when you look at it on paper, it looks great. And when you apply for a job, it seems amazing. And you get all these training days and all kind of stuff. Let me tell you about my training. I had 1 day of training because I'm a traveler. And that's all I needed. I know patients. I know the system. It's just very few things that I need help with. I went from 2 patients that weren't very sick that I had a nurse helping me with for the most part. All night long, 2 patients is all I had. To the next night, I had 7 by myself. And a guy that they thought had a stroke that I had no idea where CT scan was. You will get put in your place so fast. And the thing of it is, it doesn't matter how long you've been there. If you mess up, you're gone. They don't care. You have all these people that do things and get away with it, and they just don't care. It's because no one's checked. If someone is checking and they see that you're using too many supplies, you're the reason why the supply bill is up for $100 a month, you'll be gone. No one cares. They really don't. Nurses aren't your friends. You've got people that you'll meet, you'll form a friendship, you'll go out with them, you'll babysit their kids, have dinners at their house, and the next week you'll hate them because they told the manager on you for something, or the manager's looking into things because so and so said you hung the wrong medicine. I came to work one day, guy coded, and trying to remember, they the girl, it was a lady, she coded. Uh, they gave her Versed, which is a benzo. So I said, hey, we gave her Versed, and I misspoke and said, we need to give her some Narcan. And the other nurse that was there says, no, we need to give her Ramazicon. She had Versed. And I said, you're right. I'm sorry. We need Ramazicon. And they kept saying, what's the name of Ramazicon? And I said, Flamazanil. We need to give that. So we ended up giving it. We saved the lady, whatever. Next day, the manager calls me in the office and says, "Why did you give this lady Narcan when she took Versed? She needed Ramazicon." And I said, "I didn't give her Narcan." And she said, "Well, I was told you did." And I said, "What kind of documentation do you have that I gave her Narcan? What kind of proof do you have that I gave this lady Narcan?" And she says, "I don't. I just had someone tell me that you gave her Narcan." And I said, "No, what was said was she needs some Narcan." And then so and so said, "No, you mean Romazicon," because I misspoke. No one got the wrong medicine, but apparently there's someone there that is quick to go back and try to report someone for a misstep. Another place we call it a near miss. I don't even think that's a near miss because I spoke and said, "Hey, give them. We need to give this," and they said, "No, we need to give that." We can't give anything without a doctor's order anyway. So the doctor didn't say to give it. After the girl said, "Give her Mazicon," the doctor said, "Yes, give her Mazicon." So it was not even a near miss. It was a mistake. It was a slip up of the tongue, and I admit that. But it was not something to get called into an office. And I'll tell you, that stuff will happen all the time. You will find people that do the most awful things, and they will be the ones to report you. I knew a girl that would steal lotion every day. She'd steal lotion. She'd steal all kind of supplies. She'd go into the supply room and she'd put all kind of shit in her bag. And then she came in late one day, and this other girl gave a report or whatever. And then we went home and we came back. And the girl, she was going kind of slow. And I said, "Yeah, she is going a little slow, whatever." So the girl that steals all the lotion says, "Well, hey, come on, you need to hurry up and get your stuff together. I need to give you a report. I'm ready to go." And I told her, and I said, "Look, you come in here late every day because supposedly you dropping off your kids." And I said, "Nobody tells you anything about it." I'm like, just leave this girl alone. I'm like, this is the only time she's ever been late. And she stops and has a full on conversation with me about how I'm not going to talk about her kids, to keep her kids out of my mouth, and all kind of shit. And then this other girl jumps in too, saying I shouldn't be talking about her kids. And then this girl has the nerve to tell me that she's going to tell her husband to come up here and whoop my ass. And I frequently, "I'm sorry, that is not how I meant it. I'm just trying to say you're late all the time, and you give the same reason." And I said, "I don't think it's fair for you to be able to be late and her not to be able to be late. That's all I'm saying." And she wasn't hearing it. She just kept on, "I'm going to get my husband to whoop your ass," blah, blah, blah. Carried on to the next day. And I told her, "You know what time I get here? You know what time I get off? Tell your husband to bring his ass up here." And her husband wasn't having none of that shit because he knew exactly how she was. But that's the type of people you deal with. You can't speak to people. Certain people you can't talk to at all. Certain people you can't play with at all. You need to make sure who you talk to. You need to make sure that they're okay with a certain level of playing. You meet all these people that, especially with guys, they like to come and rub your back and do all kind of stuff. Let a guy go up to someone and rub their back. There'll be a sexual harassment claim instantly. You'll be fired. Don't ever do it. Never get comfortable like that around anybody. Doesn't matter what anybody does. Do not do that. You're setting yourself up for failure. There's just so many things that I hate about the nursing profession. And it happens everywhere you go. There's no way to get around it. You have stupid managers, the dumbest managers. And the thing of it is, some places, as long as you have a bachelor's degree, and you apply, you got it. They will put you at the top of everything. You'd have no experience at all doing anything. And now you're in charge of all these nurses who have 20 and 30 years of experience. And that just goes over so well. You've never even taken care of a patient. You're trying to tell me I need to go and do this and do that. And then you have these people, you hear it everywhere you go. They feel like people need to go and work med surge for a year before they come to their specialty because their specialty is so freaking hard. Let me tell you something. There are certain places I've worked that is severely hard. Severely hard. If I went in there as a brand new nurse, I wouldn't have been able to function. If you give me 3 months of training anywhere, I'm good. I can do anything that you can do. We got it. There's no need to have to pay your dues and work med surge. It just does not make sense. If you do med surge, then you go to OB, that's an entirely different area. You do med surge and you go to cath lab. Or I hear people say you need to go to ER first. That way that you can learn how everything goes on the front end and then you need to learn how to take care of them with this. It's not true. Just go to an area and work. Learn that area. When you go to a different area, there's always going to be stuff you don't know. So just that's all you can do. Is just go to different areas and work. And different areas and different hospitals are different. I worked ICU for the longest. Never took care of a heart transplant. Never took care of lung transplants. Never took care of LVADs. Never took care of cabbage patients. Never took care of any of that. I go to this other ICU. Never took care of any of those. Never. I go to the step down unit. I get post cabbage patients, which I've had before. Never had an LVAD. Never get anything. I go to this new ICU or this new step down unit. Now, mind you, this is 6 years after I've become a nurse. I get my first LVAD patient. So, all this time I've been dealing with these patients. And you're telling me I need a year of med surge for a specialized unit? I'm not going to see any of that in med surge. I'm not going to see people who have just these random problems. I'm going to see unit specific problems. And that's what I need to hone my skills into. I don't need to waste my time learning time management, is what they try to say. You need to learn time management there. You have 2 patients. What kind of time management do you need? You got an hour to do tasks. Go in there and do something. Come back out. Go to the other patient. Do something. Go finish the other one. That's where you can go and just do whatever. You don't have to have time management in ICU. You don't really need it because you have 2 patients. You can do whatever you need. Like you could literally just go back and forth all night, and it doesn't matter. When you go to med surge, you need to have time management because you might have 8 patients, and when it gets down to that 8th patient, and it's like, hey, I got these pills for you. Oh, they're an hour late. Yeah, now you're scanning medicines and it's saying you gave medicines late. So now you can get in trouble. That's when you need time management. But you don't need it for ICU. You don't need it for specialty areas where you have way less patients. It's important to do everything on time, but it's not as important. What people think is the way that they did it is the way it needs to be done. And it's not the truth at all. And it's like that in life. Just because someone else went through it doesn't mean you have to go through it. Well, it's still so much I can gripe about, but I said this video is like 35 fucking minutes long. I just don't care anymore. I'm hoping to get out of nursing within a year. I don't know. I just I'll talk later.